We're very pleased to see that the pain reduction is now lasting 4 to 6 weeks. This is truly meaningful in a clinical context with change in pain levels as assessed by the patients on our VAS pain scale. From a clinician standpoint, nothing is stronger than a patient to come in and say, look, I've gotten rid of or markedly reduced or gotten rid of all of my opioid drugs.
Welcome and thank you for joining us today for another Virtual Investor What This Means segment featuring Autonomix Medical. My name is Janine Thomas. I am CEO of JTCIR and I will be moderating this segment. I am very pleased to be joined by Dr. Rob Schwartz. He is Chief Medical Officer of Autonomix. Welcome, Dr. Schwartz. We're happy to have you back on.
Hello, Janine. It's a pleasure to be back.
So today we are going to discuss your 4 to 6 week follow-up data from your ongoing human clinical trial that were recently announced. Very exciting for the company, but before we get started, I want to remind our audience that Autonomix Medical is publicly listed on NASDAQ and trades under the ticker AMIX. And during today's discussion, the company will be making forward-looking statements, and I encourage everyone to view the company's latest SEC filings on their website at autonomix.com for the latest information. So, Dr. Schwartz, can you please provide an overview of your study?
Sure, thanks, Janine. In March of this year, Autonomix initiated a 20-subject proof of concept study. This had 5 additional lead-in patients to evaluate the safety and the effectiveness early on to see whether we could deliver transvascular energy to ablate relevant nerves that are related to pancreatic cancer pain and to mitigate that pain in these patients who have, in our study, advanced stage pancreatic cancer. Now, our first 5 subjects were enrolled and treated according to our protocol, and this was to familiarize our principal investigator with what the procedure was. These patients we consider as lead-in or learning patients. Those data, because they were learning, we will not include them in the final analysis with the study objectives. Our study is unblinded, meaning that we know whether the patient was treated or not. We are able to review the patient results thus throughout the study and on an ongoing basis. And because of that, we're delighted to be able to share these ongoing results as the study progresses.
Great summary. Now let's turn to the data. What were the key findings from your 4 to 6 week data readouts?
Well, Janine, we're very pleased to see that the pain reduction is now lasting 4 to 6 weeks. This is truly meaningful in a clinical context with change in pain levels as assessed by the patients on our VAS pain scale. 60% of subjects responded with a mean score of 6.67 or 83% reduction of pain on the VAS pain scale from a baseline of 8.0 down to 1.33 at the 4 to 6 week time frame post-procedure. 66% of responders reported a VAS pain score of 0 to 1 with a greater than 7-point reduction in pain score at 4 to 6 weeks post-procedure. 100%. All of these responder groups had clinically significant and clinically meaningful pain relief at the 4 to 6 week post-procedure timeframe. Also importantly, the 4 to 6 week post-procedure data showed a decrease in opioid demand, and no subjects needed any opioid dose increase. So everything considered, these are clinically significant changes, making this an early indication that we do have the potential to significantly impact a historically very difficult cancer pain to treat with our transvascular nerve ablation approach by radiofrequency energy.
Impressive, Dr. Schwartz. So how do they compare to the 7-day data you released previously? It seems like you are seeing a prolonged effect in this initial group.
Yes, Janine, indeed. We are seeing a prolonged effect from the lead-in responding group. This is important because if it was a good effect, but it lasted only a short period of time, that would be a limited clinical utility. Our patients that entered the study in the beginning with the procedure had a severe mean pain score of 8 on our pain score, out of 10 being maximum. And at 7 days post-procedure, they reported a 79% reduction in their pain score, almost 80%. At 4 to 6 weeks post-procedure, we see the pain score continuing to hold and even slightly improved with an 83% reduction at that point. So while these data are still preliminary, we are highly encouraged with the level of pain reduction that these patients gained with the Autonomix RF nerve ablation technology.
There's also a significant impact on decrease of opioid use. Can you comment on those findings?
Sure. From a clinician standpoint, nothing is stronger than a patient to come in and say, look, I've gotten rid of or markedly reduced or gotten rid of all of my opioid drugs. The significance of a decrease in opioid use is very important because the cancer-related pain often leads to an inability to eat, restricting caloric intake, and an inability to get enough quality of sleep or quantity of sleep, and a general negative impact on the patient's normal daily activities, such as their work, their housework, and of course, socializing. Current pain management that we use for pancreatic cancer include nonsteroidal anti-inflammatory drugs as the first line of treatment, followed by opioids as a second-line therapy, and then various other therapies as third-line treatments. The opioid pharmacotherapy is a primary strategy we use to manage moderate to severe pain. That is, this is sort of a last resort to be using opioids. We all know the problems that these drugs have. Many patients with advanced pancreatic cancer are on these very powerful drugs in the hope that they will improve the quality of life for these patients. Examples of this class of drugs include morphine, codeine, oxycodone, and of course fentanyl, among others. So as we said, they are highly effective at relieving pain, but they have a number of side effects that can be potentially addictive as well. The study through our 4 to 6 week time point post-procedure showed a decrease in opioid demand, and no subjects actually needed an increase in their opioid medication doses. We feel this is especially meaningful because our patients have experienced this type of improvement at a point in their disease where opioid use is typically very frequent and increases as pain is progressing throughout this to the end stage of the disease.
So I know we are here for a What This Means segment, so I have to ask, what do these data mean for your technology and development program?
Sure. Well, we want to emphasize that it's still preliminary stages, but at this early stage, we are highly encouraged that we have long-lasting level of pain reduction, we have quality of life improvement, and most importantly, reduction of their use of opioids. And also the demand that the patients have is markedly reduced. These patients have gained this as a result of the Autonomix technology. Again, the elimination of nerves that are causing the pain, utilizing an approach through the arteries. It really has exceeded our expectations. And in fact, this is just the beginning as we look further toward understanding the lasting effect of these novel treatments that we're doing and the technology.
So what are the next steps for the study and expected milestones for this program?
Well, we've already enrolled the first patients that will be included in the study population, and we'll apply our important learnings from these lead-in patient sets to a larger and longer patient set. We remain on track at this time to complete enrollment by year's end this year, and we're pleased that the positive outcome from the early stages are currently having on responding patients and relief they are experiencing from the difficulty of this horrible disease of end-stage pancreatic cancer.
Well, Dr. Schwartz, congratulations on this data. Really appreciate you sharing the outcome with us today. And this does conclude our What This Means segment featuring Autonomix Medical. I'd like to thank Dr. Robert Schwartz for joining us today. I'd also like to thank our audience for your time and attention. And as a reminder, Autonomix trades on NASDAQ under the ticker AMIX. And if you like what you saw today, I encourage you to visit autonomix.com for more information on the company, to sign up to follow the company, to receive their alerts, as well as follow their social channels on X, Facebook, LinkedIn, and Instagram to stay current on the latest information. Thanks, everyone, and have a great rest of your day.